For the second time since the start of the pandemic, troops are again on the ground in Quebec, helping now with the vaccination effort. Hospitals don't have the staff to spare.
We have to act very rapidly. We want to preserve our capacity.
With thousands of healthcare staff isolating or otherwise away from work, Quebec is the latest province to limit who can get a PCR test and reduce the isolation time for suspected cases to as little as 5 days.
You can't run a large hospital when so many people can't show up, so you can see where the expediency comes in, but it certainly is not a zero risk endeavor.
New Brunswick says 571 healthcare workers are isolating at home as officials coast to coast expect more staff shortages.
We're going to face considerable challenges with this much COVID-19 in the community.
2 Toronto area hospitals have activated a so-called Code Orange, urgently cutting services so staff can be reassigned to deal with COVID. Nurses were being stretched too thin.
We like it to be 1 to 4, 1 nurse for every 4 patients or 1 nurse to every 5 patients. And we were getting close to 1 to 10, and we felt that that was not safe.
In Ontario, case counts are reaching levels that were unimaginable just days ago. With testing restricted, experts can only estimate.
What probably happens is that we only diagnose 1 in 5 cases, meaning these 20,000 are more like 100,000 already.
And although only a small percentage will need critical care, already the impact in hospital brings this nurse to tears.
Because we have people with surgeries that are canceled, heart surgeries that are canceled, cancer surgeries that are canceled. People at the bedside are suffering. Nurses are breaking down.
Okay, so Thomas, how long are officials expecting this strain on hospitals to continue?
Well, there's going to be a peak, and then case counts are going to start to go down. Andrew, you heard the head of William Osler Health System in the piece there. He said at his hospitals, the peak might just be a few days away. But the mayor of Toronto, John Tory, said today, in this city, certainly his experts are telling him the peak may still be 4 to 6 weeks away. So whatever happens, some hospitals could still be feeling pressure well into February, Andrew.
Thomas Daigle, thank you very much.
You're welcome.